Health Minister Joe Phaahla and Operation Dudula have reached an agreement that would see the organisation stop picketing outside the Kalafong hospital in Pretoria. Meanwhile, nursing union Denosa says the health ministry isn't doing enough to regulate the influx of foreign nationals getting access to medical care in the country. The concerned union says regulating the health system is something government should have done a long time ago. Phaahla visited the Kalafong hospital today, and our reporter Pule Letshwiti-Jones was there.
Despite reaching an agreement with the health ministry, members of Operation Dudula vowed not to back down after reclaiming temporary territory from the EFF. Today, an altercation broke out once again between the two groups outside the Kalafong hospital in Atteridgeville. This time, Dudula members reinforced their numbers, chasing away EFF supporters. Dudula maintains that foreign nationals must pay for health services in the country, but the EFF says that's rubbish. The spat between the two has seemingly caught the attention of health unions. Both Nehau and Denosa say the pickets are putting a strain on health facilities and affecting patients. The unions have also called against the intimidatory acts targeting foreign health workers.
Our members and workers in general are being inconvenienced having to come to work, having been asked to produce identity documents by total strangers in order for them to prove that they work here or whether they are patients coming here. It's an inconvenience.
And we are really saying that hospital should be a place of tranquility, place of peace. If at Operation Dudula and EFF have difference, let them sort out somewhere else, but not in the hospitals. Yes, we do receive we did receive the complaint for our dark-skinned nurses that they are intimidated as well when they have to enter the premises. So that is unacceptable.
Meanwhile, Health Minister Joe Phaahla says more has to be done to regulate the influx of foreign nationals accessing medical facilities in the country.
We could enter into proper discussions with our, if we have good regulations, we can enter into discussions with the governments of our neighbors, because they have a responsibility. Every government has a responsibility for its citizens. So we need to also hold them accountable for their own responsibility for their citizens, and where they cannot, even ourselves. I mean, if South Africans are going to go to Namibia to seek help, I mean, the Namibian government must hold us accountable. If, for instance, we are unable to provide renal dialysis and people are flocking to Namibia to get renal dialysis, they must hold us accountable to say, we've got your people here who need dialysis, we can provide it, what are you going to do to compensate us? So those are the kind of things which we need to put into regulation, and we are members of SADC, for instance. The majority of the challenges are in the neighboring. We have regular meetings of SADC under the SADC Secretariat. So those are the things which we can properly table in those meetings.
Members of Operation Dudula say they've reached an agreement with the Kalafong Hospital management and the health minister to put an end to the picketing. Pule Letshwiti-Jones, Atteridgeville in Pretoria.